Chapter 2 defines the anatomical boundaries of the face and scalp and describes their underlying skeletal components. There are two study objectives here. First, describe the boundaries of the face and scalp. Second, identify the bones and major bony features that form the craniofacial skeleton. The face is the region bounded superiorly by the superciliary arches, inferiorly by the lower margin of the mandible, and posteriorly by the auricle or pinna. Within this region, the face can be divided into two parts: the central or anterior part of the face and the peripheral or lateral part of the face. The anterior face is the region medial to the widest points of the zygomatic arches, that is, the region between the cheekbones. This contains the eyes, nose, and mouth. The lateral face is the region lateral or posterior to the apices of the cheeks. This contains the external ear. The scalp is the region bounded anteriorly by the superciliary arches, laterally by the temporal lines, and posteriorly by the external occipital protuberance and the superior nuchal lines. The scalp is continuous with the thin fascial layer that overlies the deeper, heavier temporal fascia. The adult facial skeleton is composed of 13 individual bones. These are the lower part of the frontal bone, the paired nasal bones, the paired maxillary or upper jaw bones, the single mandible or lower jaw bone, the paired zygomatic or cheekbones, part of the sphenoid bone, parts of the paired parietal bones, and parts of the paired temporal bones. Some of the facial bones contain specific features of note for our purposes. On the frontal bone, we want to recognize the superciliary arches. These are relatively raised areas above the orbits corresponding roughly to the positions of the eyebrows. These are highly variable in form. The glabella is a relatively smooth area between the superciliary arches. The supraorbital foramen is a small opening above each orbit. Often it appears as a supraorbital notch right at the orbital rim rather than as a distinct foramen. It's not unusual to find a foramen on one side and a notch on the other. On the maxillary bone, we want to recognize the frontal process. This is a projection directed upward toward the frontal bone. The infraorbital foramen, a distinct opening below the orbit. The alveolar arch, which is the tooth-bearing lower edge of the maxilla. And the anterior nasal spine. This is the sharp projection immediately below the nasal aperture. There are several structures on the mandible of note. The mental protuberance is the inferior midline point that makes up the point of the chin. The body is the large bar that makes up the horizontal part of the lower jaw. The mental foramen is another distinct opening, this time in the body of the mandible. The alveolar arch is the tooth-bearing part of the mandible. The ramus is the large segment that makes up the vertical part of the lower jaw. The angle is the posterior inferior corner of the mandible. The coronoid process is the thin, triangular, anterior superior projecting part of the ramus. The condyloid process is the posterior superior projecting part of the ramus. And the mandibular notch is the semilunar concavity that separates the coronoid and condyloid processes. On the zygomatic bone, we want to recognize the temporal process, which is the posterior projection that forms part of the zygomatic arch, and the frontal process, which is the superior projection that forms part of the lateral rim of the orbit. On the sphenoid bone, we should recognize the greater wing. As its name indicates, this is a large wing-like area that forms part of the lateral wall of the cranium. On the temporal bone, let's recognize the squamous part. This is the large, flat, scale-like area on the side of the skull. The zygomatic process. This is the anterior lateral projection that forms the bulk of the zygomatic arch. The external auditory meatus, which is the opening of the bony portion of the external ear canal. The mandibular fossa, which is the concavity that forms the temporal bone part of the jaw joint. And the articular eminence, which is the elevated rim that bounds the anterior side of the mandibular fossa. The skeleton underlying the scalp is composed of 4 individual bones. These are the upper part of the frontal bone, the upper parts of the paired parietal bones, and the upper part of the occipital bone. These bones house several specific features of note. On the parietal bones, we can recognize the temporal lines. These are a set of fine ridges that arc across the parietal bones and part of the frontal bone. These are quite variable in form as they mark the attachments of the temporal fascia and the temporalis muscle on each side of the head. On the occipital bone, let's recognize 2 structures of note. The external occipital protuberance. This is the elevated midline point on the back of the skull. And the superior nuchal lines. These are a set of ridges that extend laterally from the external occipital protuberance toward the temporal bone.